I think I'm going to leave you this evening with a few thoughts about an interview that Trevor Phillips did with Victoria Atkins today on Sky. And Victoria Atkins is the health minister at the moment, probably not in a few weeks' time. And she was talking about all her plans for health. And Phillips cut in a few times and said, but, the point is, you can't do this because you've not got enough money. And it's all about your plans. He didn't say that the real crunch would have been to say, well, look, you've had 14 years to do this. Why are you only making plans now? Is it that your health secretaries haven't been any good in the past? Oh, who were they? Well, one was Hunt, another one was Matt Hancock, and they seem to have frittered away their time and spent much of their money on chasing and silencing whistleblowers. So maybe if they saved some of the money rather than penalising people who were trying to help, they might, the health service might be in a better condition. But the reality is, a third of the nurses, as Phillips pointed out, a third of the nurses we've got now were trained abroad. 1/5 of adult social care was trained abroad. We have 180,000 vacancies in healthcare, which cannot be filled by people who are trained in this country. If those vacancies could be filled, they would be filled. No, we're going to have to wait again for migrant workers to come in to fill those gaps. And in the meantime, those gaps, those huge vacancies, mean more waiting times, more overworked staff in real places rather than the bureaucrats. The bureaucrats don't go out and strike, do they? The nurses and the doctors are so heavily overworked, and particularly junior doctors who are underpaid, seriously underpaid. People working on the street get more money than junior doctors. That seems extraordinary when, if you are seriously ill, it's the junior doctor who is going to be looking after you. Is the junior doctor worth so little? Is your health, your livelihood, your life worth so little? And she went on about pharmacy first and the 7 conditions that we could go to our pharmacy for. And yet, most pharmacies have not signed up to this. Why? Because they can't afford to. She says, oh, but we will have this rolling. By when? When, says Trevor Phillips. Well, by the end of the next Parliament. That's 5 years' time. All of this is promises. Building more GP surgeries, promises. Building 40 hospitals, well, that was promised in the last election. They haven't occurred. 50 diagnostic centres. And the only thing that Victoria Atkins can say is that these things are going to be stopped when Labour comes in. The whole point is that both Labour and the Conservative Party are stumbling about because there's the mantra about not having so many migrants, and yet the desperation for people to fill these vacancies in the health service particularly. Our National Health Service is crumbling, mostly because of Brexit, because Brexit took away the workers who were keeping the health service going. They were European. And without those workers, we are struggling to keep the health service even on its feet. Anybody who's been in hospital will know exactly what I'm talking about. The system is crumbling. We don't have the money. And the pharmacy first thing, £645 million funding for this, it's nothing. It's nothing in comparison with the amount of money that the health service needs. And it's not just money the health service needs. The health service needs people. And Trevor Phillips finished his interview. And it got, once or twice, when Phillips interrupted, Victoria Atkins got louder. She got louder and she tried to finish what she was going to say. And Trevor Phillips quietly cut in. It was a brilliant interview on his part. She was second rate, but he was first rate. Why on earth is he not interviewing for the BBC? He would certainly be better than Laura Quensberg. But then his ace move, and he pointed out only 8 Conservatives have ever crossed the floor to join the Labour Party, and 4 of them have done so towards the end of this Parliament. That is remarkable, is it not? That is remarkable. And all Victoria Atkins can do is talk about Diane Abbott. Yes, I think Diane Abbott was treated appallingly. Doesn't deal with the issue. She pointed out, of course, that she couldn't see how somebody so hard right as Natalie Elphicke could possibly find a home in the Labour Party. I don't think it's about finding a home in the Labour Party. I think it's about losing a home in the Conservative Party. And people have lost a home in the Conservative Party not only from the hard right, but also from the centre ground. I think my prediction is that it's not going to be the hard right, which is a small group in the Conservative Party, very vocal, and you get the impression if you listen to them that this is the Conservative Party. It isn't. This is Mr. Farage and his stooges, all very charming people. But these are the people who talk very loudly in the pub. The heart of the Conservative Party is represented by the One Nation, Tories, and people who are even more centre left than that. And they're simply not going to come out and vote. They're simply going to remain at home because they have no one to vote for. The Conservatives will lose the election not because people vote for Labour, but because they don't vote at all. And they don't vote at all because the Conservative Party cannot be trusted. It cannot be trusted. And when its own politicians come to that conclusion, you can be pretty certain the voters are going to follow suit.